So this educational video is in regards to a bolus feeding regime for the nasogastric tube. The dietitians will give you your prescribed supplement that you need. So I'll talk you through the equipment that you require. So what you'll firstly need, and this will all be given to you by the dietitians, is a 20ml enteral syringe, and this is used to gain aspirate from your nasogastric tube. You'll also have the pH strips to identify the correct position of the nasogastric tube. You'll have two syringes, 60ml enteral syringes, one for the water and one for your bolus feed. Get 2 cups. You'll have water. We use sterile water here, but you won't need sterile water at home. You can just use normal tap water. And you'll have your bolus, your supplement drink as well. Now this is an Ensure Plus. You can have anything regards into whatever the dietitians prescribe for you. Okay, so this is the video now showing you how to bolus feed through your nasogastric tube. In regards to this setup, this is not how it will look. This is just for educational purposes only. So what you need to do first, obviously this nasogastric tube would be inserted into your nose and into your stomach. So what you need to do first is open up your 20ml syringe packaging. And if you get one of your pH strips, what I do personally is with the 1 pH strip, I pop into the sort of reservoir of the packaging here. Get your 20ml syringe and open up your nasogastric tube, take that cap off. With the 20ml syringe then you would connect it and then draw back your stomach content. You only need a drop, so once you've got that drop, reconnect that cap, and then with that drop or that stomach aspirate you pop that onto your pH strip. Now with the pH testing, for this video purpose, I haven't gained any aspirate as this NG tube is not going into any person. So just make sure that the colour will change on this pH strip, and make sure that the colours that are on the strip are 5.5 and below. So, and that is to ensure that the nasogastric tube is in its correct position. So once you've identified that it is 5.5 and below, what you can firstly do then is get a 60ml syringe and get a cup of water. You open up the packaging. What I'd say is don't take the whole packaging apart, because what you can do is once you've flushed with water once, you can repackage this tube to keep it nice and sterile. So with this feeding syringe, draw up your water. Once you've drawn up the water then, you uncap, place onto your nasogastric tube and flush your tube with water. You'll have the required amount will be stated by the dietitians also, and that will be on your feeding regime. So once you've done that flush of water, take the syringe off, recap, and then place your syringe back in its packaging. Next trick then would be to get your supplement drink, pop that into a clean cup. Ensure again it's the correct feed for you, and ensure it's in date as well. So once you pop that into the cup, get a clean 60ml syringe. Again, open that packaging up and take the syringe out. Draw up your supplement drink. I get a couple of tissues and just to wipe the tip of the syringe, as the supplement drinks can be quite messy. So once you've drawn that up, obviously uncap, attach to the NG tube and pop your bolus drink through. Now this will take a bit of time as these drinks can be quite thick. So if you are struggling to push the plunger down, you can mix it with water to make it a little bit easier to pass. So it takes a little bit of time to do this, so just be patient with it. So once you've completed that bolus drink, take your syringe off recap, and then what you can do then is get some more water into your syringe, into your water syringe, draw that up, and then you can flush your tube then to ensure it's nice and clean and ready for the next use. And always then, when you disconnect, make sure you recap. And that's how you do the bolus feeding for a nasogastric tube.